So I wanted to go over 5 of the most glaring opportunities in healthcare, health tech, AI, all of this combined. And this is going at such a fast, ever-changing pace that it is difficult to keep a track of. And I try to keep myself in line with all that is happening, but I believe I'm failing in this. But I wanted to share a couple of these thoughts with you guys. Number one, I'm going to talk about virtual reality, augmented reality, mixed reality. And I'm going to mention a few startups that are already doing a few things. Proprio is a multi-camera imaging digital representations of the surgical field through augmented reality, and it's also using AI in all of this, and they are developing the system for the surgical operating room. Now there's another startup, Icona, and they create immersive content, mixed reality applications that look to assist in patient experience and actually train healthcare providers at the same time. Actually, I'm going to mention a study here that when surgeons were actually trained using virtual reality and augmented reality methods, they actually learned faster than surgeons who did not. They actually performed quicker in surgeries than surgeons who did not. This is huge because normally when you are in a residency or learning a procedure, you have to wait around. Okay, I'm gonna wait for a case. Couple of residents, they actually fight over, not actually fight over, but actually they have a system. Okay, who's gonna go next? Who's gonna get this case? Now, if you are using these technologies, virtual reality, augmented reality, and mixed reality experiences, you are already trained, you already have a head start. And then when you do get that clinical experience, when the patient is right there, then you're able to perform better and learn actually better. So this is gonna be huge. And anybody has ideas for this, you can go in any surgical approach and find something for yourself and build a startup around that. So I do believe virtual reality, mixed reality, augmented reality holds immense promise for the future in mental health care, in surgical health care, in training of healthcare staff, whether it's medical or of the surgical types. Especially, it would make a much huger difference with the surgical varieties of healthcare and specialties. Number 2 would be home healthcare services. Let me talk about a company. Hinge Health is a healthcare company in the musculoskeletal space, and they actually deliver in-home physical therapy services through wearable body tracking devices, and they utilize virtual communication and also through physical therapists virtually, and they are able to provide this care through all these devices. With this aging population and with the growing preferences of in-home care, there's a huge demand for healthcare services increasingly at home, and huge opportunities for startups who want to get into this space. We've seen genetics make remarkable advancements in recent years, and loads of startups are in this space. And genetic testing is one. Of course, we know about the regular 23andMe, and now we have to get to be more specific, more personal, more individualized. And this will afford better care, afford patient a self of control. This space will definitely empower individuals to gain insights on their own health, how to identify inherited conditions, and of course, then work towards potential treatment options. Now, this will help healthcare providers, this will help family members and the individual themselves figuring out with the pocket in with their own apps or through other devices that are going to be developed about their own health. And they'll be able to, fix dementia or take the path to preventing dementia much before we do now. And this is a dynamic field, huge promise, huge potential, and precision medicine and genetic testing and counseling is going to be huge. Then number 4, AI-powered healthcare. Page is a startup, and they focus on optimizing patient outcomes for pathology images. Pathologist has to look through a slide and identify a slide one by one and then comment on it. However, using AI-trained programs, you can do this in minutes for thousands of pathological slides, much more conveniently, faster. The pathologists, one pathologist can look at thousands in a day that right now they just can't do that many, of course. This is a breakthrough, not just for pathology, for diagnostic imaging of other sorts, ultrasound, MRIs, CAT scans. We may say that there'll be huge changes in medical practice. Likely many of these are going to be for the better and improve outcomes and improve speed. And now we know these days that you do a biopsy, it could take easily a week for things to get back to you. But sometimes, time is of essence if you're looking for cancer or anything else. Anything that speeds things up, I think I am all for it. And healthcare startups are now leveraging AI technology to improve patient care, streamline processes, reduce costs. One example is algorithms to analyze medical data, identify potential health risk or diagnoses, capture a patient getting sick much earlier than before, and provide clinicians with more insight, more accurate insight to be able to make decisions faster. Now, huge implications with every single, you talk about cardiology, gastroenterology, rheumatology, oncology, we talked about it a little bit possibly, geriatrics, anything primary care. AI is going to be huge. One low-hanging fruit, I call this low-hanging fruit because this is probably the least technical thing to do. AI-powered chatbots, virtual assistants are going to be revolutionizing and changing healthcare settings to assist not only just administrative tasks such as scheduling appointments, answering basic medical questions, making patients aware of their health condition a little better, or getting an explanation regarding their discharge or their home monitoring plan, for example. All of this is going to free up the time of the doctors and nurses and will improve overall patient experience. The last one is probably an amalgamation of a couple of the factors that we talked about earlier. Personalized medicine. Fastic is an intermittent fasting app that allows users to track mindfulness, sleep, movement, nutrition, and they gather all this data to provide a personalized score for you to achieve your health goals faster. And whichever way you are, you could be a healthy individual, you could be a diabetic person with high blood pressure or heart disease. This company is working on it. Hybercell, and it is a biotechnology startup, and they're developing cancer treatments, and they help to create targeted specific therapies based on the person's individual needs. And this also involves genetic testing and analysis and sequence of, I believe, of tumors as well. See which possible current medication or intervention is more suited for it. Now, what we are seeing is that drugs that were developed for one type of cancer are actually being used for different types of cancers, because now we are able to analyze things much faster. With precision and personalized medicine, you are tailoring treatments and medications based on the genetic makeup, lifestyle factors, the patient's medical history, and this approach is showing promising results not only just in cancer but also for autoimmune disorders. And as we know, with our unhealthy and processed food lifestyle, autoimmune diseases are also shooting through the roof. Startups can enter this field for genetic testing services, developing software, analyzing and interpreting genetic data, and also collaborating with pharmaceutical companies to develop personalized treatments and specific diseases. So I hope this gave you a bit of idea of what is running through my mind about all the opportunities that there are. And hopefully, let me know as well. If you have any thoughts, ideas, we can talk about it further. Thank you so much. I'm Dr. Umar Khan. It's an exciting world we are living in right now. Thank you. Bye-bye.